Professor Ioannides, in yesterday's morning session on psoriasis review and updates, you held a presentation on the psychological burden of the disease. Has this year been particularly challenging to your patients?
The psoriasis causes depression and some other anxiety and some other psychological diseases, and at the same time, the depression worsens the psoriasis. So there is a reciprocal association between depression, anxiety, psychological disorders, and psoriasis.
Since the burden of the disease is quite high, obviously treatment is very important.
Yes.
You have been yourself working on 2 real-life studies, I believe, set in Greece.
Yes, not only in Greece, and in collaboration with other centers in Europe.
Would you care to just share any particular important findings from the studies that you have been majorly involved in?
The depression characterizes almost 30% of psoriasis patients. Usually it is not related to the extent of the disease, because you may have 1 lesion or 2 lesions, but if they are located at the face or at the dorsum of hand, and they affect the everyday life of patients very much. Almost 10% of the psoriasis patients, when coming to a doctor for first time, but you have to be very careful to take that history. You have to ask them twice, 3 times. They are not willing to uncover all their habits from the very beginning. They are taking some antidepressants, some drugs for dealing with a better psychological life or everyday life. Yeah, that's the usual results that we have. And sometimes if we are able to deal with depression alone, then the psoriasis goes better.
Has there been any news on actual treatments from moderate to severe psoriasis?
There are always new treatments for psoriasis, because, especially after 2016, when psoriasis was recognized by the WHO as a chronic non-communicable disease. Chronic disease means that you have to take a kind of treatment in order for the psoriasis to remain stable and under control. So after that, even today, there are coming new treatments, many new treatments, mostly antibodies against certain molecules, cytokines as we tend to say, who are heavily involved in the pathophysiology of psoriasis. So you might have heard yesterday new drugs for interleukin 36, interleukin 1, interleukin 38, interleukin 18, tyrosine kinase 2. So I just mentioned some molecules. Of course, someone does not need to remember all those molecules, against which new drugs are developed, right now are being developed for the psoriasis treatment. And actually this corresponds to the various phenotype of psoriasis, because someone can wonder why we need so many drugs. We know that certain molecules are heavily involved. We target those molecules and all the psoriasis patients are very happy. But this is not true. As we are all different among us, we look different. So our diseases are different. That's why probably one molecule is much more involved in your disease or in my disease than the others. That's why a continuous research is needed, and the identification of many molecules that are involved is very crucial. And this is what is happening right now with the research in the universities, in research centers, and in the pharmaceutical companies' research centers.
So personalized medicine is something that is very important for this type of patients.
Personalized and preventive medicine. Mm-hmm. So we are looking for biomarkers, or with the help of artificial intelligence by other kind of help, in order to be able to predict the evolution of a disease, to prevent it to a certain extent, and then to choose the right treatment for each patient. The European Academy of Dermatology is ready to finance such kind of research based in Switzerland and in other countries of the world in order to help the patients with psoriasis.
So do you think that this research will provide long-term relief in the future for those patients?
Yes. We are very close that this kind of research, we will have the tools either by the artificial intelligence helps us in order to identify certain lifestyle characteristics or other phenotypic characteristics or molecular characteristics in a patient. And this helps us to very early be able to deal with the disease. And this research, which is going right now at a very great speed, this will help very much the patients worldwide, not only psoriasis, but in all sections of medicine.
You just mentioned that the Academy is financing or is helping to finance this type of research. I believe you are the treasurer also of the
Yes, I am the treasurer. Yes, of course.
In terms of your position in the Academy, what would you say, how did the Academy assist your members this year during this COVID-19 crisis? Did you bring out certain communication tools or something?
Of course, we have organized, we used to organizing many courses, live courses, but this year we organized many more courses in terms of the webinar style. And also we communicate with the ADV newsletter. We communicate with mails, with podcasts that we implemented recently. And we are trying to help our members as much as we can with all those new tools that the electronic era of our history supplies to us.
Excellent. And one last question, which is coming back to the first one. Since you mentioned that depression is obviously one of the key challenges for your patients, and you mentioned that when the patients feel better, the course of the disease is better as well. How important is the interdisciplinary work also with psychologists, maybe, especially for this type of disease?
Yes, it is crucial, and that was my last slide actually. That I projected, that we have to be we have to treat the patient in a comprehensive and integrated way, of course with a rheumatologist and with a psychologist or a psychiatrist. However, we have to be very careful because when you are trying to contact the patient and saying to him that, you know, it's better for you to contact a psychologist or a psychiatrist will help you, the initial reaction is negative. For example, what do you mean, doctor, that I am crazy or I cannot help myself and all those things? So we have in the hospital and an advisor, a psychologist and a psychiatrist, both. An advisor for helping all our patients with chronic skin diseases, and especially our psoriasis patients. And if a patient is seen in a hospital setting, then is more willing to be part of a multidisciplinary approach, as you said before, than when he is in a private practice in an office. We will see. Of course, all the doctors, all the dermatologists are not that much educated towards that direction. So our first duty is to educate our colleagues all over the world that they need the psychologist or the psychiatrist. It's part of their everyday help towards the patients.
Excellent. That sounds great. Thank you so much for the information, Professor Ioannides.
Thank you very much, Ms. Martinez.